relationship between fluoridation
They call it for the murder of the rights of free speech. Cease and desist because the system is weak. They can't.
Fluoridation in the amounts that are required for a therapeutic dose of fluoride in drinking water and adverse health. Fluoridation in the amounts that are required for a therapeutic dose of fluoride in drinking water and adverse health effects.
In the last number of years, we've reduced the dilution or increased the dilution rate in regards to the fluoride in our water system. That was a direction or a recommendation. Why would that be? That we went all these years at a certain level of fluoride, and all of a sudden out of blue, there's a recommendation to lower the amount of fluoride we put in our water.
Again, I think that in terms of the specifics related to that, I could perhaps defer to my colleague, Dr. Peter Cooney, but my understanding is that the optimal range was adjusted based on what was thought to be the optimal effect, so that we would obtain the optimal effect from fluoridation, based on the study of the situation.
Appreciate it. Would it be true that the biggest issue with the tooth decay is not the fact you got whether you have fluoride or not, but is nutrition, is the food you eat?
Well,
if you ate it properly, you wouldn't have tooth decay. Is that correct?
Well, fluoride protects, both the fluoride that's ingested in drinking water, which is incorporated into the development of the teeth, protects the teeth itself, and then the addition of the fluoride applications that are put on the teeth also help protect against the proliferation of bacteria that actually result in tooth decay. And so both of those things help protect and provide essentially a seal of the teeth so that decay doesn't occur.
If people were eating properly, nutritional foods, would tooth decay numbers drop?
Well, again, it's a combination. Certainly dietary factors are important in terms of trying to protect teeth, but the actual fluoride itself in toothpaste, in fluoridated substances that are put on the teeth, as well as drinking water, are really important to the protection against bacteria, because those bacteria will proliferate anyway, but they do feed better on the sugars involved in sweet beverages, other things that perhaps stick to the teeth. So a good diet is an important contributing factor to overall good health, a good oral health.
Appreciate that. The other question I have is, there was something I read recently that was disturbing. And so maybe you can provide some clarity to me. Is there an organization that the doctors, public health, belong to the province of Ontario?
Through you, Mr. Chair. Are you referring to the ALPHA?
Correct.
Yeah. So ALPHA is the Association of Local Public Health Agencies. So doctors, public health physicians partake in discussions there, but it's not an organization of public health physicians. It's actually an organization of public health units. So Hamilton Public Health is a member of the Association of Local Public Health Agencies, just like Halton is, Niagara, etc.
And is it true that the edict went out within the organization that if, in fact, you have personal views in the context of fluoridization, you shouldn't be speaking to those personalized views?
I think I know what you're speaking of. This was part of a forum organized to discuss water fluoridation at ALPHA, one of the recent meetings. No, it's not true that an edict went out prohibiting any personal views being expressed. What happened is there was a piece of political advice given in one of these meetings saying, if you want to be effective, you've got to make sure everyone's singing from the same page. So it was a political piece of advice. ALPHA has no power to give any direction to any members, either individual or agencies. I'll also point out that medical officers of health in Ontario are protected under legislation and required by their college to give the best medical advice possible. And that means reviewing the literature in an unbiased and unpolitical way. If medical officers of health don't do that, then they're subject to complaints under the College of Physicians and Surgeons. And so what you've got is you've got an organization where the people within the organization all have the same opinion about water fluoridation. Now that's not surprising given that they're all looking at the same medical evidence. They all have very similar medical training, and they're all required to give an unbiased account of the facts.
Appreciate the clarification. The other question I have is, there was a documentary just recently on asbestos, and it talked about the standards in public health and how they perceived asbestos in the early days. How long it took between the time that it was okay to the point where they started regulating and creating very tight rules on asbestos. Meanwhile, millions, or not millions, but certainly hundreds, if not thousands of people were already impacted by asbestos. Why would this be different just because we haven't yet determined if there's no risk?
Yeah, I think it's important to think about the way in which we review literature. So we look at the weight. Our job as experts in public health are to look at the weight and the quality of the evidence and to determine, or give you our very best advice in terms of what the evidence actually shows. So that includes the entire scope of literature, which is what Dr. Mackey was talking about. And based on that review, our view, and that is shared, as I said, by 90 international organizations, is that, and national organizations, including organizations like the Canadian Pediatric Society, that fluoridation of drinking water at the doses that we're suggesting, in fact, is, and that are regulated within the province of Ontario, is safe and it works. And it is a very cost-effective and equitable way to deliver fluoride to your population.
Appreciate it. One last question. I was talking to my son who's an engineer, just graduated from Mac, and I asked him, because he knows a lot about chemicals, and I asked him about fluoride, and he told me, and I don't have any reason to disagree, maybe you can either support it or say it's not the case. Fluoride is one of those most significant bonding chemicals of all chemicals, and very difficult to get rid of. Do you agree with that?
Well, again, all I can say is that the additives that are put in the drinking water supply, which is hydrofluorosilicic acid, dissolves into its component parts when it gets into the drinking water to the components of hydrogen, fluoride, and silica, and those are natural components in our environment. So with specific to its bonding capacity, I think it depends on what environment it's in. I can't comment on that. But again, I want to assure everyone that, in fact, what is added to enable optimal fluoridation is safe.
I appreciate that. You forgot to mention arsenic too, because I believe arsenic is part of the chemical makeup of what we put into our water system.
Well, again, I can add just what the fluoride composition is. Again, I'm not aware of arsenic being actually added to drinking water. And so,
well, maybe Dr. Mackey.
I don't know that.
Yes. So I think your point is about the testing that is done of the fluoride that we add to the drinking water. Arsenic is not part of the fluoridation chemical. So the fluoridation chemical, as Dr. King mentioned, includes hydrogen, fluoride, and silicate. Arsenic is present at barely detectable levels. It's
Kiss my fucking ass if you think I'm gonna work off a fraudulent debt for the rest of my life. They told us freedom wasn't free and then they jacked up the price. Put a tax on your rights, but they packaged it nice, so we all bought it up without asking the right fucking questions. But life is a lesson we learn, don't you know?
Greatest trick the devil ever pulled. The devil ever pulled was convincing the world he didn't exist. In the world he didn't exist.